My name is Dr. Farid. I'm Orthopaedic Surgeon at King's College Hospital London in Dubai. I had the pleasure to meet Mr. Bassem, a young 33 years old gentleman who was complaining from left knee pain in the past 8 years.
My name is Bassem. I'm 33 years old. I've been in Dubai for 6 years now, and I'm working in the medical health insurance industry. It all started 8 years ago. I had this hit when I was playing football. All of a sudden, there was somewhere in my knee. It was hurting whenever anything touched it. It felt like electric shock. I went for several doctors, several healthcare providers, and all the diagnoses were around meniscus tear or ACL. I have been advised to go for physiotherapy, like cream or gel, to make it better, but everything didn't work. I've done several MRIs, I've done several x-rays, but it all shows the same. No health provider or no doctor could know the main reason behind this. Fortunately, I've been advised to visit Dr. Farid Ghasemzadeh in King's College.
He has done several investigations, including MRIs, and has done several physical therapy sessions and taken a lot of painkillers without getting any benefits. He came to me for a second opinion as he was offered an arthroscopic knee surgery for MRI finding. When I checked his MRI and did an accurate physical examination and take the history again, I found out that the origin of his pain is not from his meniscus injury. The pain was from a subcutaneous mass which was very close proximity to the periphery of his meniscus. I was suspecting that it might be a glomus tumor. Glomus tumor is a benign soft tissue mass, always making a diagnostic challenge. Its common location is in the subungual area of the fingers, and usually it presents with severe pain, exquisite tenderness, cold intolerance, and sometimes in the very superficial areas we can see a bluish discoloration under the nail plates. But the presentation of glomus tumor in other places is not very common. That's why it makes a diagnostic challenge. There are reports in the literature that glomus tumor can be delayed in diagnosis from 4 months to 20 years. And as we see in this gentleman, the diagnosis has been delayed for 8 years.
He took a look at the MRIs and also the x-rays done. He knew it was a glomus tumor, and he advised me to just go directly to a surgery to remove the glomus tumor. In one of my diagnoses, there was one doctor that advised that this would be a complicated surgery. It would take like around 8 hours. I was afraid of having this done, but when Dr. Farid assured that it would only take around 10 minutes, I was surprised. By the time it got done at the hospital, it took around 10 minutes exactly, and then I had to stay for like 1 hour to do after recovery at the hospital, and I went home at the same day. It was a big surprise for me.
The management of glomus tumor is just removal of that. For this gentleman, we could do a very easy surgery with local anesthesia as an outpatient basis, and he was discharged half an hour after the surgery, and the pain which he has been suffering for 8 years was gone forever.
It didn't feel right at the beginning because after 8 years with several wrong diagnoses, all of a sudden and just right away been directed to the correct diagnosis, and I had the surgery. It was painless, and after the surgery I feel great. I don't feel pain in my knee anymore.
The reason we are presenting glomus tumor is that it's a diagnostic challenge, and with the invention of MRI, there are lots of patients with MRI findings that if we don't match the physical findings with the history and don't do an accurate tests, we can avoid many unnecessary arthroscopic surgeries.